This is KLEAN Radio.
Welcome everybody out there listening to KLEAN Radio on our flagship station 790 KABC or on KLEANradio.com. That's KLEAN with a K, or on the worldwide XM.
Yeah, the worldwide was the internet.
Yeah, it is the internet.
So
no, we're
XM Radio.
XM Radio. This is
Sirius
North America,
XM.
Sirius XM, which is channel XM 165. In the studio with me tonight is my co-host Andrew Spanswick.
Hey, welcome everybody.
And welcome back from Rio.
I was in Rio for 3 days. Yeah, it was very interesting checking out what's going on down there in the drug empire of the world. So,
and how was it?
It was interesting. They have a problem with the shifting of growing of coffee has been pulled. There's sanctions against importing coffee into different countries, and so they're shifting to growing cocaine. And there's a bigger and bigger drug problem occurring. So as they move it away from Colombia. So it just moves around.
And just so everybody out there knows, you're an MSW. You're also the owner and the operator of KLEAN Treatment Center. You also have been in the industry for over 20...
Yeah, about 22 years I've been doing clinical work with both people with substance abuse as well as people with mental health issues.
And I think that's actually very interesting. And it's one of the reasons, I think it's so important is that you sort of have found this mix, this healthy mix of treating people with alcoholism, and because of your experience
all
with
addictions,
right?
yeah.
All addictions, and treating people with addictions, and because of your experience with mental illness, you're one of the few people that actually learned how to mold them both together.
Well, I think that there's been a movement where medicine has sort of separated itself out into different areas, and addiction for a long time wasn't even viewed as an illness,
Right.
So, or a disease specifically. As the recovery industry has sort of become more evolved and people have discovered different ways to treat people, and they've found that there's actual ways to prove that the use of like heroin and other substances and alcohol actually changes the way the brain functions. There's now a science involved, and therefore you get medicine involved. So as the recovery industry has grown up into a real medical sort of grouping, I moved away from just doing direct acute care psychiatric work in psychiatric hospitals and started opening up rehabs, and then bringing the knowledge that I have from working with inpatient acute care psychiatric patients into a residential setting for people with addiction, so we can treat both the underlying psychiatric issues as well as the recovery and the issues related to addiction.
And that's actually very interesting because it's one of the things I want to talk about tonight, because we'll get to that in a second, but it's this Kirstie Alley thing and this whole Scientology movement, which is really, obviously they're against taking any sort of meds for mental health issues. But give us a call. The number here is 800-222-5222. That's 800 ABC KABC. Give us a call. That's 800-222-5222. This is a great opportunity for you to get any question about addiction or recovery answered, whether it's for you or someone you care about. It's Sunday night. There are a lot of people that are driving around right now that are afflicted with addiction, with family members, with all sorts. And
we also love to hear stories of people that have gotten sober and how it's changed their lives, and offer encouraging words of wisdom for those out there that are suffering. And
and one of the things I want, before we get this, one of the things I want to talk about is, there's a huge pastor. His name is Rick Warren. I mean, he sold 30 million copies, and his son committed suicide this weekend. And I was reading today, and I knew it would come out on the blogs. People are just, getting upset. People are saying horrific things about this guy, and I'm like, leave the guy alone. His son just died,
right.
And his son just died of mental illness. And of course, they're, listen, he's not a saint. He's said obnoxious things to people, but this isn't the time to get your political, and I was extremely offended by it.
Yeah, I was actually surprised also that the father was so open about the fact that his son did have bipolar illness, and that that he'd been suffering for a long time, and that it's a serious illness, and that spirituality alone can't necessarily fix that. And in this case, unfortunately, medicine wasn't able to help either.
But at least they were trying, And for a long time, I think so many people, there's this stigma with medicine.
Right.
I can't tell you how many times I tell people, and I say this all the time, and I'll share my own personal experience, is that I was scared for a long time to take meds because I was scared that it might do something harmful. But my life, I wasn't functioning that greatly, but my fear was,
The stigma is there for a reason, though, and I think that's one of the problems with the medical field is that they haven't done a good job of explaining to people why that stigma exists and why it shouldn't exist anymore. And the reason that stigma exists is that psychiatry as an industry is fairly new in terms of psychopharmacology, and it wasn't really until Thorazine came along in the 50s and 60s that antipsychotic medication actually became effective. But now with the incredible work going on with chemists, we're now able to synthesize all sorts of medications that are doing incredible things. A lot of them we don't really know completely how they work.
Which is what I love when when Jason Coe is on the air, is because when you ask him an honest question, he's like, well, we don't know how they work.
Right, we don't know fully what there's 270 plus neurotransmitters in the brain, and we really only focus on about 4 of them in psychiatry, serotonin being one of the main ones, and that's the major class of antidepressants. So
let me get my resentment out right away.
Okay.
I'm having this huge resentment against Kirstie Alley.
Right.
I just found out she's going to be on, the new host of The View, which I don't watch anyways, but now I'm adding a whole other resentment. But she came out, she tweeted last week about Abilify. They have this ad campaign, and they use cartoons, but it's famously known that Scientologists don't use are very against, Tom Cruise went on a whole thing.
For an anti-drug position, that was a smart move because she's following the anti-tobacco lobby campaign that said that, using cartoons encourages people to smoke. I don't know how a cartoon is going to encourage a kid to take Abilify. I mean, that has to be prescribed. And Abilify isn't an antidepressant. It's a drug that works alongside an antidepressant to boost its effect. So, she just has some facts wrong there. But, the funniest thing I thought from that article was the last quote where it said that, it's all an elaborate and deadly hoax. Right. Referring to psychopharmacology and psychiatry. And I'm thinking, sounds a little bit like Scientology to me.
Yeah, no, it's exactly
like
right.
Projection of their own fears.
And here's a woman, and I'm not judging what she's gone through, but she's had her own struggles. Obviously, she's had her own struggles with weight. Which is let's face it, weight, there is a genetic component to someone's weight. There are some predetermined set points, but for the most part, it still is a compulsive disorder. Right, and obviously Scientology hasn't really worked for her weight. And, so...
Well, she has a lot of aliens in her that haven't come out yet.
That's exactly right. And here's the thing. What happened to erring on the side of caution? What happened to erring on the side of... we're not saying to people out there, you have to be on meds. But we're saying if it's needed, it's okay. As the counterpoint is, why can't they be like, listen, we have no opinion,
Well, like I was saying, I think that, psychiatry has done a bad job of explaining that, the early attempts just to get people, if you go to an acute care psychiatric hospital, people that are just used to seeing people that are normal and fine, they don't understand how bad mental illness can get. I mean, people, you see the crazy guy in the street and you just dismiss them. But that's really, you go to a psychiatric hospital and you'll see wards full of people like that. Right. And it's a serious problem. And for a long time, we've desperately been looking for medications to try and not fix these illnesses because we have no cure for them. All we can do is treat the symptoms and put them into remission. And so for a long time, we've been looking for different medications that will actually do that. And as the medications that have improved since the 1950s, and now, the 80s was when antidepressants really came in, and you went from, they used to give horrible antidepressants and electroconvulsive therapy for depression because that's all we had. And the choice was people either be in a vegetative state where they would just lie in bed and be absolutely miserable and want to kill themselves, or you'd have to take an aggressive intervention, like actually using ECT or giving them a drug like tofranil, which side effects were like complete dry mouth and a sexual dysfunction, just feeling all shaky and like you've had like prickles all over your skin. So we went from that to now where we have a whole range of drugs. And now it's become a bit of an art. It's still not all science. There's still an art. And it takes a really good clinician to understand and look at all the different types of symptoms that are going on and look at the genetic profile. There's now some genetic profiling tests that we can do that actually show what antidepressant people will respond best to. So we're getting better and better, and the drugs are getting better and better. And it really bothers me when we attack the pharmaceutical companies that are actually the ones that put all the R&D. They put billions of dollars into researching mental health, and that certainly doesn't come from our government. Our government has, zero interest in funding mental health, unfortunately, or very little interest, and that's unfortunate.
And if you just tuned in, by the way, you are listening to KLEAN Radio. Give us a call. The number is 800-222-5222. That's 800-222-5222 or 800-ABC, KABC. We're talking tonight. I'm in the studio with Andrew Spanswick. We're talking tonight about a little bit about antidepressants. And I think this is such an important thing to talk about because, first of all, you know, a lot of people we see stop taking their antidepressants. We see a lot of people, you know, there is a stigma with this stuff.
Well, that's the number one problem we have actually with treating people with mental illness is something we call medication compliance. That most people that have a mental illness will get on a medication, it starts to work, they think they're better and they stop taking it. And then there is such a stigma about taking the medication that people also, they don't want to be on it. They feel guilty or shameful about taking it.
Do you think that's a personal thing or do you think that's a societal thing?
I think it's different for every person, but I think that all those factors play into it. And, you know, it's different for each person, but certainly the societal aspect. I mean, look, mental illness is nothing that's been, you know, the reason that I actually went into working with the clinical mental illness, that was my first master's degree, that I started working with acute care psychiatric patients was because I looked at what group did I see out there that needed help that was the most feared, vilified, and least understood. And it was definitely the mentally ill. And I think substance abuse is very similar. You know, you have the same sort of issues where people blame people for, you know, their lack of willpower, shame, weak-willed people that, you know, don't have any sense of self, and they don't understand that there's, you know, genetic and physical components to addiction.
And so people out there that are driving right now, give us a call because I know this is one of the hardest things to talk about. You know, for people even in the industry, for somebody like me that's sober, you know, it's one of the scariest things that I had to deal with, that, you know, sobriety wasn't enough. Right. You know, I couldn't understand it either. I couldn't understand, well, I'm sober, I go to meetings, I do all these things, but it's not enough.
Well, human beings are very, very complex, and we only understand about 1% of how the brain actually works. And we, you know, constantly exploring it and trying to figure it out. And because it's not just like an on or off switch that you can, you know, turn addiction on or off, we have to deal with all the aspects of human behavior that affect that illness. So if you have an illness like diabetes, it's not just dealing with blood sugar, it's dealing with changing people's eating habits.
The underlying issues.
Right, making sure that they test their blood sugar levels 5 times a day. You know, incorporating a whole different lifestyle of exercise. And there we have no stigma whatsoever, or we have very little stigma, you know, compared to that of mental illness, where there's or addiction, where there's a huge stigma. And if, you know, we dare to suggest that there were lifestyle changes and things that people should do differently, all of a sudden it's like, oh, you know.
I call these people metaphobes, and that's my word. That's the word I made up. Metaphobes. And it's always people that are against medicine that need to be on it.
Oh, metaphobe. I get it.
You know, it's sort of like homophobes, but it's, most people that are homophobes are usually gay.
Right.
In this case, it's metaphobes. Everybody that's anti-meds
really needs to be on medication.
And I don't think there's any bigger proof of that than Tom Cruise jumping on a couch or Kirstie Alley's weight ballooning up and down. These are or John Travolta. I think I found 3 famous Scientologists.
Well, he's just suffering from denial. Yes. That's a whole nother problem.
But still, meds might help him out greatly. And if you have any, I mean, this and this is the thing. It's good. I like the topic of laughing about this stuff, of talking about this stuff, because there are people that are so isolated because of the issue of meds.
Yeah, I mean, we laugh about it. For someone that's living it, it's serious. I mean, you know, you get so shut down and isolated, and we see that as, you know, the number one sort of trait of someone that has a problem with addiction is they begin to isolate themselves more and more. And a lot of that is shame-based. A lot of that is that they, you know, don't want to expose other people to what they're doing. They're hiding, you know, they're hiding their behavior. They're hiding what they're doing. You know, they feel terrible about it, but they've got themselves to the point where they can't stop, and they're caught up in a cycle where they've gone from use and abuse into addiction.
And here's the thing. For people out there that are listening, you know, whether you're scared to call in, you want to call in, don't take your mental advice from actors. You know, that's the best thing I could say tonight is don't. Take it from somebody like Andrew, who's been in the industry for a long time. And the cool thing is you've seen the shift.
Well, I got to tell you, it took me 5 years of working in acute care psychiatric hospitals, working with really mentally ill people at the highest level before I really understood what I was doing. You know, and I can say that now comfortably, that it took that level of experience day in and day out of working with, you know, people with extreme mental illness to really understand the difference between, let's say, delusional behavior with bipolar illness versus acute schizophrenia. paranoid schizophrenia. These are complex illnesses. They show themselves in many different ways. People with substance abuse often are covering up and self-medicating for a variety of underlying mental health issues, and we have to baseline people. So, which means that if somebody comes in with a problem with addiction, the first thing we do is we get them sober, and then we evaluate them to see what underlying psychiatric problems might be going on.
And another interesting story that I want to get into, because it's extremely linked, is the Scientology Narconon rehab. And this, I know it might sound like I'm ragging on Scientology.
Well, look, L. Ron Hubbard, who started Scientology, was mentally ill. He suffered from bipolar illness
and a massive alcoholic.
Right, and a massive alcoholic, and he hated psychiatrists because they would try and stop him from doing what he wanted to do, which was be a little manicky, right, and come up with crazy stories. Yeah, and then drink. And that wasn't the type of, he liked being ill. And that's part of the problem with, some of the issues with bipolar illness especially, is that people that are bipolar like being manic. Right. Because it gives them a sense of energy, it gives them a certain creativity.
And is that why they stop taking their meds?
That's why they stop taking, because they get too, what they call flat or flattened out. They feel too normal, and they don't feel creative, and they don't feel like they're thinking aggressively. And, people that are really in an active manic state actually, and I'll give you an example. I had a patient that I worked with when I was working in a hospital in New Orleans, and this woman actually convinced everybody in the neighborhood that she had a bunch of money, and she bought all the houses in this whole neighborhood in New Orleans, and then she convinced a contractor that she had money, and she had all the houses plowed down, and then she convinced another contractor that she had money, and they built a fence around the whole neighborhood, and then she convinced a farmer that she had money, and she bought 5 horses and put them in the field. And then finally, by the time they figured out that she was just bipolar and manic, it was too late. All the houses were gone, and there was this horse park in the middle of New Orleans. So, yeah.
That's a pretty crazy story.
It's amazing what, people can do with their minds.
And if you just tune, and that's the thing. I think that's the hardest thing for people that are going through with their family members, because so many people with bipolar have beautiful minds. They're creative. They're brilliant.
Well, it doesn't. The illness itself doesn't define the entirety of the person and their mind. So a person could be like in the movie A Beautiful Mind. He had schizophrenia, but that didn't mean that he wasn't also a genius.
But I think that's the hard thing that families have such a hard time with. Is they
look,
can't...
if someone in your family becomes an alcoholic, that doesn't define their personality completely. They're still who they are underneath all that. The problem is that the alcoholism, the addiction, has overcome who they naturally can be, and they've actually become arrested in their development at the part that the addiction took over. If they can actually get help and get into recovery, they'll return back to where they were right prior to, when they became addicted. And so then the question is dealing with that loss of time during addiction, all the damage that was done, the anger, the resentment from the family members, and then also the self-fears and the self-doubt that the addict themselves have about their ability to recover and regain a normal life.
And if you just tuned in, you are listening to KLEAN Radio. That's KLEAN with a K. Give us a call at 800-222-5222. That's 800-ABC-KABC. We'll answer any questions you have. In the studio is Andrew Spanswick, owner and operator of the awesomely good KLEAN Treatment Center. But one of the things that I found amazing is that I didn't even know this until we did research on this about a while ago, was that Scientology actually owns a rehab called Narconon.
Right. It's actually, they own several.
Right. And I had no idea of this, and I know people that have gone to Narconon that had no idea
it was Scientology,
that it was a Scientology-based rehab. Yeah. And they did a whole expose on it. Brian Williams did for NBC News. They found out that 7 people have died there since 2005. And I'm not ragging on that. Listen, people sadly
die in rehab.
People die in rehabs. It's one of those things. Yeah. But that's 7 people is a lot. And they also, how do you treat people if you don't believe this is a mental illness? And that,
there's lots of issues like this where people believe that when there isn't a convincing, very, very successful treatment option for everyone, which in the case of alcoholism and drug addiction, where we don't actually have a cure, we actually only have a way to sort of treat the symptoms and then keep people in remission, you're going to have a high relapse rate. And that unfortunately allows a lot of, for lack of a better term, dime store gurus to come in, and come up with their own, psychological babble. And they can get results that are, just high enough to sort of continue.
But isn't it, what's amazing is that, isn't it almost the antithesis of Scientology? Because in 12 steps in therapeutic world, you're saying you can't beat your mind.
Right.
You know, your mind has got you beat in many ways, and until you admit you're powerless and you get the treatment you need, whereas the opposition is saying with Scientology, it's mind over matter. You could cure everything with your mind, and we're sort of saying no, it's not true.
Well, I once again, I think that every individual is different, and there's all sorts of different types of addiction, and there's people that just abuse substances that have gotten themselves in trouble. So I think that both those statements could be true for any one individual. At the same point, it takes a professional to really be able to figure out what stage of addiction somebody might be at, or use or abuse, and whether or not they have the cognitive capacity to actually correct their behavior through modifying their, not drug use really, but drinking, or whether they're at the point where they're sort of out of control and they need a more full intervention. And then if you have an underlying psychiatric disorder that really requires, good psychotherapy or good cognitive behavioral therapy along with medication, that's not going to be treated by any kind of thinking.
Right.
So, that's something that really needs professional treatment.
And the biggest thing is, we're talking about a lot of this stuff. The biggest thing is that you're not alone. When you're dealing with addiction, it's the most isolating thing. It's not just isolating for the people that are going through it. It's extremely isolating for the families. And if you're out there, you're driving, you're listening, you don't have to be alone. There are people out there that are like us that are trying to help.
Yeah, there's a lot of help out there. And there's people that are sensitive in the community that understand that. And once you actually get into recovery, you'll find you all of a sudden go from thinking that everybody's drinking in the restaurant to realizing that barely anyone's drinking in the restaurant, and the loudest table in the restaurant is a sober table.
That's so funny that you say that, because when you do get sober, you do realize that not everybody's...
Oh, yeah. When you're drinking, you think that everybody's just getting loaded at the restaurant.
Well, also because most of the places you are drinking are bars.
Right. The only thing you do notice is the one person that seems to leave half a glass of wine on the table, and you can't believe it.
So, by the way, if you just tuned in, we have to go to break. You are listening to KLEAN Radio. Give us a call now at 800-222-5222. That's 800-ABC-KABC with any questions you might have. We have a great show going on tonight. We have a couple calls lining up. We'll take them after the break. The discussion continues at KLEANradio.com.
Are you struggling with an addiction that's ruining your life? Want to have a confidential conversation with a professional that will immediately assist you? Do you suspect a loved one is abusing drugs and would like a free drug testing kit and consultation? KLEAN Treatment Center is standing by right now to help those with addictions and the people who care about them. Call 888-601-6040. That's 888-601-6040. Or go to KLEAN Treatment Center, that's clean with a K, KLEANTreatmentCenter.com.
Welcome back to KLEAN Radio. We're in the studio with Andrew Spanswick, pretty much a man that can answer almost any question on mental illness that one might have, because he's mentally ill himself. No, he's not. He's just an all-around good dude that doesn't judge people, that's an MSW, that's been in the field for a long time. And let's get to the calls right away. Let's go to Clark. We have Clark in Santa Monica. Welcome to KLEAN Radio, Clark.
Thank you.
How can we help you tonight, Clark?
Well, I'm really curious, the way that the therapist is talking about medication. When I look at the physiological actions of the medications, it raises concerns for me about what the long-term implications would be of being on those meds, especially something like SSRIs.
Mm-hmm. Well, that's a good point. And most SSRIs are not meant for long-term use. They're meant for about a 6-month to 2-year period to give a person a time in which they can be relieved of the immediate effects of depression and then get therapeutic intervention. Unfortunately, and I think this is a big problem within medicine, is that a lot of general practitioners are handing out antidepressants and not consulting psychiatrists.
This happened to a friend of mine. I got to tell you, I'm shocked.
Yeah, and so if you look at the scientific studies, what it shows is that medication on its own has a very poor result. Therapy on its own has a very poor result. But if you do therapy with medication, the results go up almost double.
So if somebody, because I see this so often, people get on these meds and basically the doctors just look at it as, okay, we got you on the meds, now we're done.
Right.
And people don't realize that their bodies are being changed by the medication
Well, yeah, we don't really know that. I mean, I don't think your mind is definitely how your neurotransmitters are affected, and what's called the neural gap is affected. So, like SSRI is what it basically does is it reduces the amount of reuptake of serotonin in the neural gap.
Can you tell people out there what SSRI
basically that
stands
means
for?
Serotonin reuptake inhibitors.
Okay.
So basically what happens is that serotonin is what allows the brain cells to communicate with each other. And so by not allowing the serotonin to be reuptake by the dendrite, which is part of the nerve cell in the brain, it allows for more serotonin, so you get better communication between the brain cells. And that gets people out of the feeling of depression. There's, sometimes people naturally suffer from low serotonin levels and do have to be on some sort of medication for longer than 2 years. But most people that will suffer, and 50% of the people in their life will suffer from some sort of moderate to severe depression. And there's a lot of good medications out there that can stop people from becoming more depressed, vegetatively depressed, or suicidal or homicidal. And those are the people that we're worried about. And, I encourage people that have problems with depression not just to go to their GP. Start with your GP, but then go further than that. See a psychiatrist or a really good therapist that works in conjunction.
And test one out too.
Yeah,
Don't go to the first psychiatrist you see. It's like a mechanic. Get a quote.
Yeah, like I say, I started this conversation off that everybody's different, and so the same therapist is not going to work for everybody, and that's why it's important to shop around and make sure you're doing your homework as well. And also, I think it's important to be informed, like you are. What's your college name? I'm sorry,
Clark.
Clark. It's important to be informed and concerned about medication, but it's also important to be educated and informed about how they should properly be used and what the positive benefits are versus not using them at all, which can be devastating.
Clark, did we help you out?
Yeah. It's just when I go back to the action, you're talking about the reuptake of serotonin, and you look at what would happen if somebody was on that for a long period of time. Are you familiar with the term of downregulation?
Yeah. So, that's what we see with meth, where, but the effect of meth is way overblown. So with meth, you blow out all the reuptake sites. And so basically you need more and more serotonin constantly. But these drugs are not like that. You'd have to be on, serotonin, an SSRI for probably 20 years to even equivalent maybe 6 months use of meth. So,
but I think what Clark is asking is great because, this is what we want to be here. We want to be dialogue for people that have questions about this stuff, Clark.
Yeah, and also I think it's important to realize that these drugs. One of the things with antidepressants is generally if somebody's going to be on for a long period of time, people will switch around, and that since there's so many different effects on different neurotransmitters. If someone really has long-term chronic depression, they will switch. They'll switch from Prozac to something else, and they'll switch around as their body changes. And remember also, especially with women, hormonally, they're changing dramatically throughout their life. And so there's always a need to constantly evaluate and change the medication.
Clark, thank you so much for the call. If you just tuned in, you are listening to KLEAN Radio. Give us a call at 800-222-5222. That's 800-222-5222. Give us a call with any questions you might have. Let's go to Edwin in Irvine. Edwin, welcome to KLEAN Radio. Edwin? Edwin, are you there?
Yes, I'm here.
Welcome to KLEAN Radio. How can we help you?
Well, my wife is in the drug detox business. She doesn't work at Narconon. I know you guys have been talking about that. She works with a medical facility in Orange County, California.
That's great.
And, the problem is that, she comes home, she's been doing this for a number of years. The people that are checking into the facility, these are medical doctors.
Right, medical detox. Right.
Medical detox.
Right.
The majority of detox that they're seeing are the people that are on the very drugs that are supposedly the ones that are supposed to solve the problem. And these people aren't on one drug. Some of these people are on 7 or 8 drugs.
Yeah, this is actually something that's happened really since the 80s. And a lot of it also is happening the age range has gone up. So what we're seeing is people that normally would have died, and I hate to put it so bluntly, but from other types of illnesses like heart disease, and now that people are living longer, Now they've gone to so many doctors and they start adding pill after pill after pill. And then they get to the point where they keep taking it. And instead of dying at like 65, now they're getting older and they've got 20 more years of life. And now they have to deal with the fact that they've overdone taking a lot of medications. The other problem is that there's very little coordination between all the different doctors. So they'll doctor shop with 3 or 4 doctors that aren't talking to each other, and they end up, and the pharmacist is often the one that will start signaling to people that people on too much drugs. Now there are some very positive changes that are going on. There's now a registry for medications, so people can't go to multiple pharmacies and load up on the same type of drugs with more than they should. And doctors are able to actually look up what prescriptions a patient has from other doctors.
Edwin, since you are in Irvine, there's it's a shocking story about the heroin use in Orange County, that it's with teenagers, that it's extremely on the rise.
I'm very familiar with that, having grown up in that area. But my point is that here we are saying, and we've admitted on this radio station, that we know 1% about the brain.
Right.
Yet with 1% of our knowledge, we're actually experimenting. And it isn't just that we're extending life. Actually, this is destroying tissue, which is found in medical reports by competent medical doctors. At you can go online and find out who's the Mayo Clinic, etc. I'm not an expert myself, and I don't claim to be. I'm just saying that my wife's been coming home, working with medical professionals, and these people are now having exacerbated medical situations because of the drugs. These are medical doctors.
Right. I think
here we are going into a field with 1%. We don't fly an airplane with 1% of knowledge of flying an airplane.
I don't really get the sorry Edwin to interrupt. I don't really get the 1%. What is he?
No, that's what he's talking about. That we really only sort of know about 1% of how the brain functions.
Right.
That doesn't necessarily mean we don't know what works and what doesn't work.
Essentially, Edwin, I mean, we could say that almost about everything, that we only have 1% of knowledge on food, but we still eat it.
That's not true. That's not true. I mean, the fact of the matter is we know more than 1% about how to drive a car or fly an airplane.
Yes, but I don't know how it's built. Edwin,
here's my let me give my take.
All I'm saying is that here we go. I'm just saying that I've seen it firsthand, the stories, and I ask people to don't believe me. Do your own research.
I actually agree with you. I agree with you that there's a terrible problem. If you go to medical detoxes, which is the most severe clients are in medical detox, they're people that have to be in a hospital to detox. And if you come to my facility, KLEAN Rehab, that means that you can actually do what's called a social detox. So you're not at the point where you've been using so many medications or so much medication for so long you have a major problem. When I was working in acute care psychiatric wards, we would have medical detoxes attached, and that's why they're in hospitals. And these are people that are very, very ill generally. They're people that have had long-term chronic illnesses. A lot of them have severe underlying psychiatric illnesses. And so they're on a ton of medication. They've been on medication for a long time. And a lot of these people also have been on medication from the 80s and early 80s and 70s, when the drugs were much more primitive than they are now. So we're getting better, and I think that the medical field is starting to be more responsive with trying to monitor what people are on and making sure they don't just take random medications. But I do believe that we can always get better, and I think it's a shame that the AMA and other groups have shied away from not being more aggressive on monitoring prescriptions and working hard to provide better outcomes for people.
But Edwin,
I agree, and the purpose of my call was, I think you touched a great point there, which is if they're willing to prescribe it, they need to take the same willingness to take responsibility for the effect, the after effects of their prescription.
Right. The only thing that I would qualify that with is that having worked with all these different levels of care, from the most severe to residential rehab level to even outpatient clients, is that there's a real danger of scaring people away from getting help. And there's a real danger of people not getting the right help. And one of the reasons that we do the show, and that the reason that I actually started and built my own facilities, was because I knew that just going down the standard line prescribed by Medicare and other groups that just sort of dictate through regulatory bodies what should and shouldn't be done wasn't the way we were going to get to solutions to solve all the problems of mental illness. And that's what makes us special at KLEAN. And I'd encourage people to look us up on the net as well and do some research on us and see what sort of innovative work we're doing.
Edwin, we got to run, but thank you so much for the call, and thanks for the dialogue.
Yeah, it's great.
Thank you.
Thank you. So we just got off the phone with Edwin. If you just tuned in, you're listening to KLEAN Radio, Andrew. But one of the things Edwin was talking about is, and we talk about this a lot because, often when we hear when people are in rehab, they go, oh my God, I'm sick. I feel horrible. I'm not feeling well. Why is it that I'm sober now and I'm getting sick?
Right.
And we often tell them it's because when you were using, you weren't going to the doctor.
Well, also you were self-medicating
Right.
a lot of what made you feel sick.
That's exactly
So,
right.
yeah.
So how many of
You're
these
covering
people,
up.
and I don't have the statistics, obviously, of Edwin's wife's facility, but how many of those people had physical illnesses?
Well, like I was saying, by the time
Yeah.
you get into a medical detox,
Right.
you're in really, really bad shape.
Right.
To have to go through a medical detox, you generally have you have to be able to qualify to admit to a hospital.
Right.
So that's that right there. And if anybody is familiar with how insurance plans have been cutting your benefits, you'll know getting admitted to a hospital is not as easy as it used to be. So
and I love and it's very scary when he says a statistic like that. But you have to always check with every statistic.
Right.
You have to check the underlying things.
I also think
too.
it's really important to realize that, that shows you the level of which addiction can get that out of control. I mean, where people are where they're on, tons and tons of medication and they are having physical effects from taking too many medications for too long because that they haven't had the right treatment, that we need to actually have medical detoxes at that level.
Right.
If we had earlier intervention, if we had people that had a better understanding of addiction, that had better understanding of mental health, a lot of these people wouldn't get to that point.
And that's one of the things, actually in the next coming weeks, we're going to talk a lot about medical detox. I really want to get into that more because we don't exactly have a lot of time with
Right.
that tonight. But what is a medical detox? Because all these words sound so scary to people.
Yeah.
And, we work in the field of mental illness. And it's just
Really quickly, there's
yeah.
something called a continuum of care.
Right.
So, and it's basically, if you think about it, it's from lowest level to highest level of care.
Right.
So when you talk about people detoxing and having to get off all their medication, the highest level that you could possibly go to would be a medical detox. So that's the worst case scenario for someone that's addicted.
And so you used the word before. What is it that we have at KLEAN?
We have
It's
a social detox model, which means that we're basically allowed to detox people on an outpatient
Okay.
basis or on a residential facility level basis with a doctor that comes in and helps them detox.
So give us a call at 800-222-5222. That's 800-222-5222. Or I've always wanted to say this number because I'm the biggest KABC fan, and we're on it. So 800-ABC-KABC. Yeah. And let's
Judah's
go to...
dreams come
It
true.
is. I have very small... I
Loves KABC.
I love KABC. It's an amazing station. And let's go to... We have Jeannie in Santa Monica. Jeannie, welcome to KLEAN Radio.
Hi. Right now, I'm using the book Your Drug May Be Your Problem by Peter Begin and David Cohen.
Uh-huh.
And I'm trying to use it to get my daughter off her psychiatric drugs because they are killing her. There's so many side effects. And
Can I just ask quickly how old your daughter is and what she's been diagnosed with?
she's schizoaffective.
Schizoaffective? Okay, so
Okay,
that's
so
that's
just
a personality disorder. And then also, how old is she?
She's 35
35. Okay, and when did the problem start?
when she was 18.
She was 18. Okay. All right, so, okay, so...
So is there a place that could help her off, detox her from psychiatric drugs?
what is
has
what is she on right now?
Clozaril.
Clozaril, okay.
What is Clozaril?
Clozaril is an antipsychotic. Has she had issues where she's actually been like hearing or seeing things, any hallucinations or delusional thoughts?
Not even before she was on drugs. She's worse than when she was on drugs.
You know what?
No, she doesn't have that now. No.
But
didn't
she's
have-
on the medication. So, what I would recommend is that you get a really good psychiatrist and have her reevaluated.
Yes, but the thing is, doctors they will get you on a drug. They are not willing to get you
not
off.
all doctors.
Yeah, that's not all doctors.
Yeah, there's a really great doctor we work with. His name's Dr. Ko, and he actually uses medication as a last resort. I've worked with him for over 22 years.
And Jeannie, here's the thing. I'm not a medical professional. I'm sober. And one of the reasons I wanted to do this show with Andrew, and I love doing this show, is because I get to pick people that I trust. And Dr. Ko is an awesome, amazing, who's been on the show. He's an amazing psychiatrist. And he's not one of those guys. And I get it. Psychiatrists, they're hard to trust sometimes. There are a lot of people, mechanics.
Well, I think like everybody in the medical profession, unfortunately, psychiatry has been pressed by reimbursement rates. And so they don't get enough time to spend with the patient and really get into what the issues are.
So don't give up.
I called Novartis and asked them how they could help me get off the drug, and they said, "Oh, they have nothing to do with that."
Yeah, usually drug companies. That's actually great. That's
a great.
hysterical.
That would be a great call to record.
I am going to. By the way, just so you know, Jeannie, I want you to stay on the line after this call, and we're going to put you in touch with Dr. Ko. But I'm going to clip that together.
But let me just say that the drug that your daughter's on is a very, very powerful drug, and it was really brought about to deal with schizophrenics. So,
it hurt every part of her. She has to go to a heart doctor. It makes her pulse beat faster. It affects her mouth, her teeth. It affects her. She's tired all the time. She has vertigo. She can't do physical exercises. She has dystonia where her eyes roll up in her head. Now she's working on tardive dyskinesia.
Right, those are long-term. Those are long-term effects. Yeah, those are long-term effects of antipsychotics. She certainly probably shouldn't be on that one if she's having that level of side effects.
Well, how do you get? We have to get her off of it. She went into a psychosis. She was thrown into a psychosis by just to go down 12.5 mg, and had to call 911. She fell on her face and had to have stitches.
I understand your pain and I understand the frustrations. I mean, you're dealing with one of the most serious medications and one of the serious mental illnesses that are out there.
Are there detox places for people like
Absolutely. There's all sorts of help. We're going to put you
on. If you stay on the line, Jeannie, we'll give you a resource of all these different places. So please hold on, Jeannie. I mean, Jeannie, oh my God. Jeannie, I'm sorry I accidentally dumped the call, but if you call back,
just call back in and she can
I'm really sorry about that.
Dr. Rand.
Yeah, call us back at 800-222-5222. That's 800-222-5222. I am the courage that Jeannie has, Andrew, to call in and talk about this stuff because she must feel so alone right now.
Well, I think you can hear in her voice the pain and frustration that people that are dealing with a family member that has mental illness go through.
And it's amazing that she called Novartis, that she called the drug company.
That shows how desperate people are for help with mental illness. And unfortunately, it's a field that's really had a lot of cutbacks, and most people don't have the money to really get the proper help they need.
Right.
And the community mental health centers and other places that basically get government funding. The doctor will see people for 50 minutes and stick them on a very powerful drug. So,
and we do understand, by the way, that it is a very touchy issue to call about. And last week after we got off the air, we had about 3 calls come in. So I'm just going to give out this number. It's 888-601-6040. That's 888-601-6040. Give that number a call if you have any questions. And we know you're scared. I mean, this is a terrifying subject. I mean, my first I got to tell you this. I needed a therapist one time. I needed a psychiatrist, Andrew. So I go to my therapist and I say to him, I need somebody. And he goes to me, he gives me somebody's number. And the first thing the psychiatrist says to me is, it's $600 an hour. And I said,
that made you depressed.
I said, right. And I'm like, okay, I guess I won't be seeing you.
Right.
And that's somebody that has knowledge of people. Yeah. Imagine the people that don't. So if you have an issue, just give us a call.
Well, also, with KLEAN, we work on a sliding scale. Yeah. We work with a lot of people. We give away 10% free care.
Yeah.
I got in this business not to make money.
And if it was up to you, you'd actually give away every bed scholarship.
Well, I think it's important that people pay something because I think it's important that people take ownership of their own treatment.
Yeah.
When you just give something away completely, often people take it for granted. So, but at the same point, we're very open to realizing that all the people don't have the resources they have. And, when we give away free beds or we give subsidized beds, we tend to get a lot back. We have an incredible alumni group.
Yeah, it was amazing tonight, actually. Let me just say this. So we come from KLEAN, Andrew and I, and his beautiful girlfriend from New York, Louisa. And we're driving here after the alumni barbecue, and one of the clients, P, his first name starts with, he was in the back seat with us, and he's got 99 days today.
Yep.
And we were driving him back to his sober living facility, and it was a great car ride. It's so amazing. hearing his story about how he got into treatment,
how he got arrested,
and his
right, his mother tricked
right.
him into going into treatment, basically.
Right, and 99 days later, he's looking for a job this week. He's in the gym, he's going to the
and he
gym.
said he would never stay in California for more than 30 days, and he's been here 99 days working with us.
And his probation is working out for himself.
He's almost getting off probation.
Yeah, he's almost getting off of probation. So 99 days ago, so the people out there, 99 days ago, this kid was a mess.
Yeah.
And the thing is, he couldn't have seen.
Well, he was smoking crack nonstop. He was on a 3-day binge right before he came in.
And he couldn't have seen it. But let's go quickly. Let's go to, we have Rick in Florida. Welcome to KLEAN Radio, Rick.
Hey, good evening. Enjoying your program.
Thank you, Rick.
Great.
I feel like that, I drink. I mean, I wish I could quit drinking. I'm sure if I really decide to, I can. But I've got some other things that are going on. And I'm just wondering, it will make no sense to try to go into those if I don't quit the drinking first. I just don't really have any goals. I don't feel very motivated. I kind of feel like, I'm stuck.
You have, Rick, what is called alcoholism.
Yeah, Rick, how old are you?
I'll be 60 in July.
Okay, and how long you've been drinking basically, I guess, your whole adult life?
Yeah.
Okay, well, alcohol is a depressant.
Right.
So it will make you feel depressed, especially the longer you use it. So the first thing that, I would recommend is that you actually try to stop drinking for 90 days and see if you can live without it. And if you can't and you feel worse, that means that you've actually probably become physically addicted to alcohol or psychologically addicted to alcohol, and you've been self-medicating an underlying depression.
But going back to, do you think that's a little dangerous for Rick? Because you constantly, Andrew, are talking about the detox from alcohol. What's scared me with Rick?
Right, well, we haven't asked him how much he's actually
how
drinking.
Often do you drink?
I'm sorry?
How often do you drink, Rick?
How much are you actually drinking?
Yeah. Oh, how much I drink? Well, see, I have a job that allows me to, if I want to, because I travel and I have flexible hours. But on some days, if I'm working from home in my office, I might start at 11 or 12. Or then some days if I work all day out in the field, I may not start till 5 or 6. But the quantity, but it's almost every day.
Every day.
And the quantity is could be 3, 4, or it could be 7 or 8. But if I'm with a group and it's an all day thing where everybody's drinking.
What are you drinking? Not that it really matters, but.
Well, mostly beer, but if I'm drinking and I don't want anybody to know I'm drinking, I will put vodka in a water bottle.
Okay,
by the way, that doesn't work.
That's a lie. They all know. It's one of the only people.
Vodka inserts does not cover up.
Rick, you're talking to a former fellow drinker here. Trust me, they know with vodka. We're the only ones that don't realize it. Rick, what you have is obviously, I'm guessing you drink as much as you can in that time period you're allowing yourself to drink.
Yeah, that's not 100% true.
Okay.
But it's probably 80% true.
Okay, that's 80 is close enough.
Rick, the thing is that obviously you're calling in, you're using alcohol. The heavy drinking, according to the AMA, is 3 to 5 drinks 3 days a week.
So you're an obese drinker, is what he's telling you.
Right. So you're at least at minimum at best abusing alcohol, and at worst case scenario, you actually now are addicted to alcohol and have alcoholism.
And here's the thing, Rick. You called in talking about I'm not gonna about the other stuff that you have issues with, or you're trying to. Here's the thing. It pays. You asked, does it pay to quit drinking before you deal with the other issues, and the answer is 100% yes.
Right. I think the important thing is to really first go see your doctor. Yeah. If you have a general physician, if you haven't seen one in a while, go see your doctor and don't lie.
Yeah.
People go into their doctor. There's no reason to lie to your doctor. Everybody gets that form and it says, do you drink alcohol? And everybody lies and they put 2, 3 drinks, when they're drinking as much as you are.
Where in Florida are you located, by the way?
Bradenton.
That's like the one area of Florida I'm not familiar with. I used to live in Delray. But there are a lot of amazing facilities out there, a lot of amazing 12-step programs. Rick, why don't you stay on the line, and we'd love to talk to you more with any questions you might have, because, I know you're 60, but 60's the new 60's the new 40.
I'd say 30.
60's the new 30.
70's the new 30.
So, Rick, happy birthday, and you're 30 now. And you have so much more to live for. You don't have to feel, you called in, you said, I drink, but I feel like I'm standing still.
Yeah.
and you have no forward thinking.
That's a classic sign
That
of
is alcoholism.
Alcoholism, because you basically arrest your development at the point that you become alcoholic. You start just not being able to do anything other than try to keep functioning.
Everything you have summed up is alcoholism. But Rick, here's the thing, and this is not just to you. This is to everybody out there listening. There's a cure. You know, there is a cure for alcoholism. And here's the cooler thing, and I heard somebody say this, it's the only disease that leaves the sufferer in better shape than before they had the disease when you get sober. You know, nobody after they get cancer goes, woohoo, you know?
Well, some people do.
Yeah, right. But Rick,
Lance Armstrong did.
Right.
He had some assistance too.
But Rick, with alcoholics, it's the only disease when you get sober that you were better than before you even got the disease.
You know, the thing is, you're so shut down, and if you're feeling depressed, that's a horrible feeling. Nobody needs to feel that way, and there's a lot of hope for you. So, you know, we can help you out in a lot of ways. One way is we can, you know, help you get connected with a doctor for a pre-screen. The other thing is, if you really need help, you know, we have a treatment center. So we have several locations throughout the United States, and we'd love to help you out.
Okay, Rick, we got to go, but please stay on the line, okay?
Okay.
Andrew, that was, you know, I mean, we have a lot of amazing phone calls tonight. We're not going to be able to get to Bruce, who's on the line, but Bruce, we will take your phone call after the show. You know, it's amazing. It's what people are going through.
Yeah, you know, it's encouraging though that people are calling and people are talking about these subjects, and you know, we're here to help. So if you know you don't happen to get on the phone call with us during the show, please check us out at our website, cleancenter.com. It's clean with a K. And, you know, we have someone 24 hours, 7 days a week available to talk to somebody. And that number is 888-601-6040. That's 888-601-6040.
And I think also really cool is that you could go to Facebook. One of the things I love, and we have amazing conversations with our Facebook fans, you know, with with our Facebook friends. And we have these amazing dialogues going on. It's a lot of fun. Go to KLEAN Radio /Facebook.
Other way around.
Facebook. Oh God, I'm going to get that one of these weeks. I'm going to get that right.
Well, you get free dyslexia treatment at KLEAN. That's good.
And that's Facebook /KLEAN Radio, or you could also look, and it's really cool. A lot of times people come up to me and they say to listen to a lot of our old shows. You can go to KLEANradio.com and listen to some really, you know, some shows.
Yeah, we have 103 episodes up there.
A lot of episodes that I have not missed one of.
I know.
And,
well, I travel.
Yeah, and I'm scared of planes. So it works out perfectly, this dynamic we got going on here. And it also takes a lot of people to help get the show going. I want to thank Patrick. I want to thank our director, Rand. I want to thank Steve behind the board and Cal over there. And I want to thank everybody at KBC. I also want to thank our call screener who say that one more time. Mark, he's a really cool guy, and last week after the show I was in the studio with him, and when one of our callers after the show, and it was so amazing how supportive you were of this woman that called after the show, and I want to thank you very much for that. It helped me out. And I want to thank everybody out there that's listening, that's driving. I want to thank everybody that's a fan of the show, and I want to thank you again it's amazing. I always love when you're back in the studio. You do have to travel a lot, but it's cool what you're traveling for. You're fighting the fight.
Yeah, we're trying to do a lot of stuff internationally, so it's good.
And for the last time, give us a call if you have any issues at 888-601-6040. That's 888-601-6040. Don't worry about anything. Just give that number a call. The worst thing you could do for yourself right now if you're going through something is not to call that number. Until next time, KLEAN.
Are you struggling with an addiction that's ruining your life? Want to have a confidential conversation with a professional that will immediately assist you? Do you suspect a loved one is abusing drugs and would like a free drug testing kit and consultation? KLEAN Treatment Center is standing by right now to help those with addictions and the people who care about them. Call 888-601-6040. That's 888-601-6040. Or go to KLEAN Treatment Center, that's clean with a K, cleantreatmentcenter.com.